So you or someone you know is considering corticosteroid medication or is already using it. We hope this video was able to inform you on the use of corticosteroids and their effect on the body. Corticosteroids are hormones that are naturally synthesized in the body in small amounts. This is from the steroid cholesterol and occurs in the cortex of the adrenal glands. There are many structurally different corticosteroids with specific functions, yet there are two broad categories involved in renal functioning and medication. The first being glucocorticoids, such as in prednisolone medication. The second being mineralocorticoids, such as fludrocortisone in Florinef medication. Thus, artificially synthesized medications can also have slightly different chemical structures in order to be used for different specific purposes. This dictates how the medication is administered. For example, asthma puffers are used to administer glucocorticoid medication to the lungs, as this enables anti-inflammatory actions on the airways, reducing asthma symptoms such as wheezing. From looking at the table, you've probably already used these medications at some point in your life. So, how do they work? Naturally, when a corticosteroid is released into the bloodstream, its non-polar chemical structure enables its diffusion across cell membranes. Resultantly, it binds to the NR3C subfamily of intracellular receptors. Once a hormone receptor complex is formed, proteins associated with the receptor detach, uncovering translocase sites to enable the complex to move into the cell's nucleus. Dimers of the complex move into the nucleus, where they can then interact with DNA at sites called receptor elements, or at co-activator molecules. Different complexes will have specific effects on DNA, yet the main activity involves either the up or down regulation of a gene's transcription, leading to more or less formation of a gene product. The level of response may vary dependent on if it involves genes, such as transcription factor genes, that code for gene products that affect other genes' transcription. It's also dependent on the concentration of hormones released and the concentration of hormone receptors within a cell. Now we'll separately consider how glucocorticoids, including cortisol, and mineralocorticoids, including aldosterone, have effects on the body. For glucocorticoids, release is primarily dictated by the hypothalamic pituitary adrenal axis regulation of the adrenocorticotropic hormone, otherwise known as ACTH. Corticotrophin releasing factor, otherwise known as CRF, is regulated by the hypothalamus due to trauma, infection, or due to the body's circadian rhythm. Since it is a releasing hormone, CRF causes ACTH release from the pituitary gland. ACTH itself then releases glucocorticoids, dependent on their rate of synthesis in the zona fasciculata within adrenal cortices. When no longer needed, release suppression occurs via somatostatin hormone release, decreasing ACTH, and also increased levels of corticosteroids in the blood, decreasing ACTH and CRF release. So what do glucocorticoids actually do? When present, cortisol, the main glucocorticoid, suppresses the immune response. It does so via stabilizing lysosomal membranes so that they're more difficult to rupture for release of inflammatory enzymes. It also decreases white blood cell transport into inflamed areas of the body, preventing white blood cells phagocytosis of damaged cells. And finally, it prohibits antibody formation, particularly T cells, which also have a role in causing inflammation. Consequently, this leads to reduced inflammation of an area that would have previously been affected by the immune response. However, cortisol has a range of other effects as outlined, which can cause the following symptoms from medications, especially when taken in higher dosages over long time periods. It decreases the uptake of glucose by cells, therefore increasing blood glucose levels. Resultantly, this also initiates a greater rate of gluconeogenesis to enable cells to produce enough energy. It encourages muscle and tissue protein breakdown to increase amino acid levels in the blood and trap amino acids for deamination in the liver, resulting in protein synthesis inhibition. Hence, decreased muscle mass may occur, along with muscle weakness, potentially causing tremors. It increases fatty acid mobilization from adipose tissue to the bloodstream, leading to redistribution of fat or weight gain. It works in conjunction with and enhances the action of noradrenaline, leading to vasoconstriction and thus increased blood pressure. It decreases calcium reabsorption from the kidney and calcium absorption by the gut, meaning that calcium is obtained from the bones, causing increased risk of osteoporosis. It causes increased chance of mood swings, mental illnesses and/or disorders, and trouble sleeping. However, the mechanisms for why this occurs are currently unknown, and, as previously mentioned, it causes decreased immune response, leading to increased risk of illness, ease of bruising, and worsened symptoms of illness. Now onto mineral corticoids, which are instead more so regulated by the renin-angiotensin system. This system involves arterial blood pressure increase to release the enzyme renin from the kidneys. This causes a cascade of events leading to the formation of angiotensin II, which enables blood vessel constriction acting alongside the activity of the noradrenaline hormone. This increases blood pressure along with the decreased reabsorption of potassium and increased reabsorption of sodium ions from the kidney proximal tubule, meaning that more water travels via osmosis into the blood vessels. When enough sodium and water have been retained, the rise in arterial pressure decreases renin release, enabling the kidney's excretion of more water and sodium despite any continued presence of aldosterone. Consequently, homeostasis is enabled by preventing too much water and sodium reabsorption. At the cellular level, aldosterone involves the stimulation of the sodium-potassium ATPase pump on the basolateral side of the cortical collecting tubule membrane within the kidney nephrons. This causes increased secondary active transport across the anteporta, whereby sodium ions are moved out of the cell and potassium ions are retained so that they can be excreted from the body via urine. Therefore, aldosterone is essential to body functioning. However, when orally administered as a medication, high dosages could contribute to the development of potassium loss, since aldosterone stimulates potassium movement from the bloodstream into the kidney nephron for excretion, hypertension due to increased water leading to increased blood pressure, which could lead to cardiac enlargement as a result of stress on the body, and potentially congestive heart failure. Hence, any illness whereby the adrenal cortices or kidney is damaged or non-functioning may be aided by corticosteroid medication. For example, in Addison's disease, oral doses of Fluranef, containing mineralocorticoids, or prednisone, containing glucocorticoids, are used as hormone replacements so as to prevent the following: weakness, mental health issues, hyperglycemia, hypertension, cardiac toxicity, and circulatory shock. Although corticosteroid medications can be incredibly useful and, in the case of Addison's disease, life-saving, the previously mentioned symptoms and further considerations need to be taken. If you're not yet using medication and are pregnant, breastfeeding, a smoker, someone that uses nicotine products, or are currently taking another medication or have pre-existing health conditions, you should talk to your doctor about the effects of corticosteroids so that you can make a well-informed decision. Those already taking corticosteroids should be aware that obtaining new symptoms from medication, having contact with particular diseases, or undergoing a major stressful event warrants a trip to the doctor. Furthermore, medical staff should know of your medication usage before medical procedures are undertaken. For no reason should corticosteroid medication dosages ever be spontaneously changed, as this can worsen or cause undesirable symptoms. Instead, ask your doctor about changes you can make to your dosage. Finally, if you're taking medication, it's recommended that you obtain some kind of identification of your use of corticosteroids in case of emergency, and to continue or improve on your healthy lifestyle choices to be living as symptom-free and happy as possible. Thank you for being informed on corticosteroid use, and we hope this video has been of help to you.